appreciate you bringing in the creativity part of things and adding the community aspect because I don't think we talk too much about the creativity or the arts that is public health and just how it is not just an exact science. There is a lot of art that goes behind the work that needs to be done to prevent and promote health throughout communities.
Yeah.
So I was telling you before the show that I used Bing's generative AI, what's it called, cool pilot, to like just look you up. And one of the things that it shared with me is that your passion for the field began at an early age, influenced by your upbringing in New Orleans and the impact of Hurricane Katrina. Would you like to share more about that?
Sure. Honestly, being a Hurricane Katrina survivor is actually what introduced me to research and made me hungry or like inquisitive about public health. So when Hurricane Katrina happened, I was in ninth grade. I was a freshman. I was in high school for 2 weeks when Hurricane Katrina occurred. And, I had a high school mind. I thought that, we were getting ready to go to football games. And, I got home from school that Friday and my mom was just like, hey, we got to evacuate. And I'm like, what? We've evacuated before. We live in New Orleans. Of course, we have storms all the time, literally have evacuation down to a sign. But this time seemed a little bit different. And that's because it was, my family moved away to a different town. And, it was a long journey, a road trip that would have taken us about 8 hours, ended up taking us over 24 hours to get to where we were going. A lot of the hotels and stuff that we stopped at were at full capacity. And, later on, weeks later, we learned that a lot of those places we stopped ain't there no more. Like they got completely destroyed. Thank God we didn't stay there. Um, but anyway, we moved to a new city. Lucky me, I got to go to ninth grade for the first time all over again, a second first day. And on my first day at this new school, I can remember it like it was yesterday. I was pulled out of class and they sat me in a classroom and it was with other kids from New Orleans. And then a group of folks started asking us a series of questions about our experience in Hurricane Katrina. And I felt kind of exposed. I wasn't ready to talk about it. I didn't really know a lot about what was happening back home because my parents were trying to protect us from a lot of what was going on and the fact that we lost our home and all of our things. And it wasn't until after that experience I learned that those folks were evaluators and they were doing a project about the youth who had been impacted by Hurricane Katrina or who were in the process of being impacted by Hurricane Katrina. So that really, I'm like, okay, well, what's an evaluator? And like, what is this? And like, what type of projects, that really kind of piqued my interest. And I just started, you know, paying more attention to when people talked about research and things like that. And like, years later, I decided to go to college and I hadn't really discovered public health yet, but I knew that I had a health focus and I used that to apply and that vision to apply to school. We have to write an essay and all that. And I really just, that experience of going through Hurricane Katrina, number one, seeing the impact it had on my community, having to have my community be rebuilt, and then that experience of being interviewed or questioned in a very extractive way about my experience really helped me see what I wanted to do in my career and kind of shaped my trajectory, honestly. So that's really what led me on that path.
Well, firstly, thank you. Well, firstly, I'm sorry that happened and the trauma, and I could imagine what I could only imagine, I should say, what that looked like. But and I'm glad from that experiences that you were able to get a better understanding of health and like just shaping that you wanted to do things that impact community health and figuring that out. And as you was talking about the people asking you questions, all I'm thinking is like traumatizing. Like how can they just come in and just like ask that? And I'm thinking about how can we really create better ways to collect that information and really protect people from the trauma that they have just faced, their families have just faced, their communities are facing. Because and I could imagine like that in itself was probably something in the embodiment of while this is cool and they're doing this cool evaluation type stuff, there probably was a better way to do
Yeah,
that, and to really, as you say, like not be extractive, but be supportive to the people that you are trying to get information from.
right.
So that happened in ninth grade. You decided to get your bachelor's in psychology and chemistry at Xavier University of Louisiana. Tell us about
Yes.
that thought process.
Yes, I really when I was in high school, I found that I was really gifted in psychology of all things. Like I took a psychology course and one of my professors, he's so dear to my heart. He challenged me. He was amazing. Like he made us write like essays on Thoreau, like things that we had never talked about. I didn't know anything about until I had met him. But he signed me up to do like a competition, a statewide competition around psychology. I guess he saw too that I was really interested in the subject and doing well in his class, and I won the local like the city competition, and then he signed me up at the state level, and I won that too. And I'm like, hey, I think
Hey.
I'm good at this. I think this is a talent or something. So when it got time to apply for college, I knew that I had that health focus. I knew that I wanted to do something in health, and psychology was a major. So I wanted to go the psychology route. And I actually wanted to go to medical school when I first went to college because I hadn't discovered public health as we know it today at that time. So I went the pre med track, and that was the chemistry and psych focus.
Well, shout out to you for winning those competitions. That's
Oh,
dope.
thanks.
That's dope.
Thank you.
First of all, and I'm glad like that really like showed you that you could do like this work, and like guided the path into you going into college. Many of us, I'm also pre med, recovering pre med, I guess maybe, I
Yeah,
don't
recovering. I love
know.
that.
uh, but I think it's just important that like there's some sort of direction as we're going, and then from there, then I think like you sharing your story today and just really understanding is like there's so much that we can do in public health. Public health intersects in so many ways. There's so many ways to get involved in public health. So I think like getting people exposure to public health as early as possible is most beneficial. So with that, I say thank you for being on the show.
Thank you.
And then yeah, yeah, of course.